Types of Animal-Assisted Intervention, presented by Christine Hellstrom, occupational therapist. Did you know that there are 3 distinct types of animal-assisted intervention? If you didn't, don't worry, you're not alone. Although most research regarding the health benefits of human-animal interactions surrounds the benefits of physical interaction between humans and animals, there are other types of interactions that involve simply viewing of animals, resulting in positive well-being outcomes. Not all populations of people are suitable for physical interaction with animals, and not all animals are suitable for physical interaction with humans. Have you ever seen someone take a fish for a walk? Of course not. Let me explain things a little better for you. The first type of animal-assisted intervention is titled implicit. With implicit intervention, clients are either observing or simply being in the presence of animals. Animals are part of the therapeutic social environment, and their purpose is to help redirect the client's attention outward. Animal contributions are in terms of appearance and/or natural behaviors. Presence of the animal may enhance rapport or trust. An example of implicit animal-assisted interaction in an acute care hospital setting would be the presence of a fish tank containing several colorful fish in the space surrounding the nurse's station. These fish may assist with helping patients to direct their attention outward and focus externally. Another example of implicit intervention would be the presence of a bird in a cage located in the gathering area of a nursing home. Residents could be encouraged to watch the birds in order to assist with directing their attention outward. A final example of implicit intervention would be the presence of a turtle or a hamster in a tank located in the classroom of elementary school-aged children. These animals would not be physically touched or purposefully interacted with, but their presence may contribute to relaxation, direction of outward attention, and enhancement of rapport and trust. Welfare considerations for animals in this category include ensuring proper nutrition, access to water, controlled temperature recommended for the species. For example, tropical fish may need an aquarium heater. Proper monitoring of health and access to healthcare as needed. Assurance that the clients do not disturb the animal. For example, repeatedly tapping on a fish tank, which could induce stress in the fish. And regular cleaning of the immediate environment. The second type of animal-assisted intervention is titled explicit. With explicit intervention, clients demonstrate simple contact with an animal or are being directed to observe. Animals are passive therapeutic agents and help to encourage rapport, focus, or outward attention. Animals can also encourage sensory or cognitive processing. An example of explicit animal-assisted intervention in a long-term care nursing facility would be a long-haired rabbit being introduced to the residents in a controlled manner during an afternoon activity session. The rabbit could be brought to different residents in order to assist with directing attention outward, to assist with focus, and to encourage sensory processing through simple contact, like petting of the rabbit. Another example would be the presence of a facility dog who occasionally visits residents. The residents could pet the dog, and the presence of the animal could result in increased cognitive processing. A final example of explicit intervention would be the presence of a cat during a behavioral mental health session with a licensed clinical social worker. The client could hold and pet the cat, which may result in development of increased rapport between the client and the practitioner. Welfare considerations for animals in this category include ensuring proper nutrition, access to water, controlled temperature within the environment, proper monitoring of health and access to healthcare as needed, assurance that the clients do not tease or act aggressively toward the animal, and access to a clean and quiet rest space. The third type of animal-assisted intervention is titled instrumental. With instrumental intervention, clients and animals participate in directed activities and interventions. Animals are active therapeutic agents providing opportunities for meaningful interactions. Intervention is focused on skill building and developing or practicing new behaviors. An example of instrumental animal-assisted intervention in an acute care hospital setting would be a dog employed during physical therapy treatment sessions as an agent of active therapy intervention. The patient may be encouraged to reach for and throw a ball for the animal to retrieve, with the goal being increased range of motion of the patient's upper extremities, as well as improved standing balance. The patient may also be encouraged to walk a distance down the hallway while accompanying the dog, with the goal of increased mobility and endurance. You could even have a client work on grooming the dog, which would assist with improved upper extremity range of motion and sitting balance. Welfare considerations for animals in this category include ensuring proper nutrition, access to water, controlled environment temperature, proper monitoring of health and access to health care as needed, assurance that clients do not tease or act aggressively toward the animal, access to clean and quiet rest space, and opportunities to participate in regular species behaviors such as playing outside, exploring, and playing with other dogs. Here are my references, and I hope you have a better understanding of the types of animal-assisted intervention. Thank you.